to Lift Life's podcast on breaking barriers to caregiving. My name is Shiva Sambandam, an 8th grader at Lake Highland Preparatory School. Approximately 50,000 people suffer from some disability in Central Florida, and the caregivers face immense challenges to care for their loved ones. Accessing available resources has always been challenging. Our first speaker is Dr. Jag Ambwani from One World Pediatrics. Dr. Jag Ambwani MD, FAAP, is the owner and founder of One World Pediatrics in Longwood, Florida, and a passionate advocate for pediatric health. A board-certified pediatrician, Dr. Jag trained at the prestigious Children's Hospital of New Jersey, where he received the Best Resident Award for his work in underserved communities. With global experiences in India, the UK, and the US, his specialties include ADHD treatment, allergy immunotherapy, and care for children with special needs. Dr. Jag's holistic approach highlights his dedication to exceptional care for the next generation. All right, so right now, Florida is experiencing a big population boom, with it being the fastest growing state in the country, with many special needs children coming in from out of the state. It's been challenging to know what resources are available. What advice would you give to a new family with caregiving duties in Central Florida?
Thank you, Shiva. I think it has been a challenge to find right provider for these patients. All these special needs patients are struggling to go on the Medicaid. Many times they don't know how to navigate the system because Medicaid programs are differently named in different states. So sometimes patients get confused and they go without care sometimes for 3 to 4 months.
All right, so when a family moves to Central Florida, how do you recommend that they find the resources and services for special need children? Can you name a few resources that can help the caregivers?
Sure, it's a very good question. I think the most important website is My Florida Access for Medicaid patients. There's a Healthy Kids program for people who are slightly higher on income side. They have to pay copay, but they still qualify for special needs program through Healthy Kids. And third option is the ssa.gov, which is a social security website where you can apply for SSDI benefit, Social Security Disability Income. And to apply for that, you will need to bring your medical records and all the medications from the previous doctors if you're out of state. You need to know the diagnosis of the child. Many times parents do not want to fill out these forms. So that's where the care becomes very challenging because they do not know what diagnosis to put for qualification. And that's where they need a very good primary care doctor who's aware of the system. And those primary care doctors help them navigate the system more easily.
Right. What would be the timeline for these new families to get started with the services in Central Florida?
If families are given a case manager right through the Medicaid program, sometimes they get hold of case manager in a day. They can see the doctor or they can get admitted in the PPEC in 5 days. It can be as quick as 5 days. But many times there's no case manager available, there's shortage of case managers. Or sometimes they can't get into the primary care clinics. And these patients sometimes go without medication for a month or two, which can be very challenging.
At One World Pediatrics, what are the services that you offer to children with disabilities, and how do these families know that the One World Pediatrics is one of these service providers for special needs children?
Yes, Shiva. So it's sometimes challenging for parents to navigate what services we provide. The easiest way to go on ACA website and search a facility finder, where you will see the different type of service providers. Pediatricians who see special needs kids, their name is listed, and pediatricians who are enrolled in the PPEC model. PPEC is Prescribed Pediatric Extended Care for special needs. Their names are listed there also. And there are many other ways to find it. Like many doctors don't have up-to-date website, but there are back-end special needs program through Nathaniel's Hope, which has list of all the PPECs available in Central Florida. And PPECs are actually more time saving for parents than they can think of, because PPECs children also get PT, OT, and speech services, including medical transportation.
Okay. Well, it's very interesting to know about PPEC. Can you tell us a little more about the service that's provided through your program?
Yeah, sure. So PPECs were available in the market for last 30 years. Unfortunately, they have not been marketed, or they have not been very popular because the home healthcare agencies have taken away most of the patients. But since COVID times, there was a shortage of home healthcare staff. A lot of patients were searching alternate ways to get care, and that's where the PPECs got their name included into search engines. PPECs also save time because parents can leave the child from 6:30 to 6:30 p.m. Monday through Sunday. Some PPECs are even open till midnight, so parents don't have to worry about providing nursing care. These nurses give them the all medication, G-tube feeding, tracheostomy care, and they also document everything on the EMR. So parents get a full summary of the report by end of the day. Our team includes physical therapists, speech therapists, occupational therapists. They work closely with the families to improve their development. And we also provide medical transportation, which is also covered for these special needs kids. So parents don't have to even worry about coming here in person. We can always pick them up and drop them off. Thank you.
This seems like a lifesaver for families that need to have a job to provide for the children with disabilities. Furthermore, what age group do you enroll in your PPEC services? What demographic and insurances do you accept at Little Angels PPEC?
Yeah, it's a good question. So in terms of demographics, we see babies coming out of the ICU all the way up to 21 years of age until Medicaid is active. We do have different size rooms for each group, different activities. Each child has their own need. So these PPECs are very specialized to see from babies all the way up to 21 years of age. We do take most of the Medicaid insurances because PPEC is run through the CMS. CMS is Children's Medical Services. This is a special needs program given by state of Florida, and most of these patients fall under Sunshine Health. Sunshine Health is a HMO which will cover your PPEC services, PT, OT, and speech services. There are other smaller plans like Simply Health, Humana Medicaid, Aetna Better Health. There are some private payers, but they cover only therapy components. For nursing component, patient needs to have a secondary Medicaid. Patients who have cost of share, we work with them closely, so if they already met the deductible, then the Medicaid will cover pretty much everything for them in these centers. Thank you.
What outcomes have you seen from your PPEC for the children? How do families decide between home health, PPEC services, and or standalone therapy clinics?
Yeah, so PPEC is more of a game changer in the industry, we call. It saves a lot of time by providing nursing, therapy, medications, and the food program for nutrition, and also providing the medical transportation in one place. So if parents are working, they have full peace of mind. As compared to home health, they do not know which nurses will see them, what they will come. Many nurses come only for medication, then they leave. Many times there's a HHA, which is home health care aide, who does not know how to give the medication properly or provide tracheostomy care. So documentation is poor in home health as compared to PPEC. PPECs are more regulated. They are like more or less nursing homes for children with special needs, and we believe that outcomes are much better because we try to prevent the readmissions back to the hospital. because we have a medical director on board, which is a big, big difference between home health and the PPEC.
How many children are currently in your PPEC program? How many centers do you have in Central Florida? And do you have any case managers that take care of the new families?
Yes. So currently we have 2 centers and our census is about 40 to 50 patients. But we had graduates, almost up to like 150 patients have graduated from our services. Means the development got better, the G-tubes were out and they were discharged. So we are opening one more in Apopka, which is going to be our 3rd center. And we expect that that center will get busy in first 6 months. We do have case managers. Our main RN care manager is also actively involved with coordinating with hospitals. Like whenever there's a discharge coming from the hospital, she'll call them, she'll follow up with the patient. She will guide the family how to activate the Medicaid transport. She will also guide them how to start the process of admission. She'll give them the tours. So we do have 2 case managers, one for Longwood, one for Orlando. Thank you.
All right. Thank you, Dr. Jag, for sharing such valuable resources and insights for families who are new to the Central Florida area. When it comes to ensuring your child with disabilities to get the care that they need, it is essential to start by applying for special needs Medicaid through CMS. Once your Medicaid determination is approved, the next step is to visit acca.myflorida.com, where you can search for a facility that offers pediatric prescribed extended care services. This is a key resource because with PPEC, families can often secure up to 80% coverage for their child's care needs, giving them greater access to the support they deserve. It is a simple but vital process to ensure that your child has the care that they need without the financial burden. Tune into Lift's Life podcast to learn more about resources in the community for families with disabilities. Thank you.
Very good.